and today I'm going to demonstrate on how to give a first aid treatment to the person who has an injury. Sprain and strains are common injuries that affect the soft tissues around the joint. Sprain ailment has stretched or torn, while the strain is when the muscle has been overstretched or completely torn. These are the three things you should look for: pain and tenderness, difficulty moving, swelling and bruising. If this is someone who have sprain or strain, you should remember the rise, rest, ice, comfortable support, elevation. The one that has sprain or strain, let them sit or lay down and support the limb in a comfortable position. To cool the area, apply a cool compress or ice pack wrapped in a towel. Leave the ice pack in place or wrap a soft layer of padding around the area. Then tie a support bandage around the area to hold it in place. This needs to go up as far as the next joint in its side, with the injured area as support with its substance cloth like a cushion. In this case, you can use a sling. If the pain is severe or can't use a limb, you will need to go to the hospital. Otherwise, just tell them to rest it. At least you have care professional if necessary. So remember, when caring someone with sprain or strain, rest the infected area, ice will have cooled the injured down, give them comfortable support with soft cloth bandage, keep the infected area elevated. And that's how you treat someone with sprain or strain. A break or crack in a bone is called a fracture. A bone that is not punched to the skin is called a closed fracture, but sometimes a bone can punch to the skin. This is called an open fracture. If you can see any blood, the break, it will cause some internal bleeding. Bones that are still growing, like children's bones, it can split, crack, or bend quite easily. A bit like a twig, the injury still be very painful. If you think someone with a fracture, you can see swelling and bruising. It may have difficult moving, might be moving in a different direction. Its limb looks like shorter, twisted or bent. It may be grating noise or feeling in the limb, have loss of strength or see signs of shock. If you think you've broken a bone, support the injured part to stop it from moving. This may help ease the pain or further damage. Place padding around injury for extra support. If it's an open fracture, cover the wound with a cloth or dressing and secure it with a bandage. Apply pressure around the wound, not over the bone, to control any bleeding. Call the emergency hotline number for emergency help. While waiting for the emergency help to arrive, don't move the casualty unless there's immediate danger. Support the injured area. For example, the fractures of the arm can be secured against the body with a sling. The fracture to the leg can be secured to the uninjured leg with a triangular bandage. Keep checking the person for signs of shock. Do not raise the injured leg. So remember, pad and support the injured area. Use a sling or a triangular bandage to keep it secure. Cover any wounds and call the emergency hotline number. And that's how you treat the person with a fracture.